Welcome to another episode of the Granite List Live, where we talk about all things related to human capital and employee benefits. I'm Lee Dill.
And I'm Sally Pace. And we are so excited about today's episode because it's a unique spin on what is happening within the pharmacy industry. We are joined by Ryan and Jordan from Prism, and you all do some really incredible things across the board. We are going to double down on 340B. So
let's do it.
I think we should. But I think what we need to do first is help the audience understand what is 340B and why is Prism even operating in this space?
Sure, yeah. So 340B is a federal government program that allows qualified entities to capture savings through pharmaceutical manufacturers. The program established in 1992 by the federal government with the intent to offset subsidies that the federal government really gives these state-run entities as well as not-for-profit hospitals. It's really a way to help keep these entities' doors open. Without 340B, many rural health centers or clinics throughout the country wouldn't be able to sustain business.
And Ryan, tell us a little bit about Prism let's take a step back and Prism as a whole.
Absolutely, Sally. So Prism Health Group was really founded on the premise that the pharmacy industry in and of itself is super complex. And with that complexity, not a lot of folks really understand the inner workings and how to help not only employer groups, but all different entities that have some form or fashion of interplay in the pharmacy industry. They need some trusted advisors, counselors, if you will, to help navigate the tides, whether that's a hospital health system, a union case, a large employer group, mom and pop shops, you name it. If it has anything to do with pharmacy, we built this company to be truly aligned and independently aligned with those folks to help them make better decisions.
Perfect.
What kind of decisions would they be making? If I've never heard of 340B or I'm a employer or a union group, why do I need your guidance?
Well, that's a fair question, Lee. I think one of the biggest things that we hear in the marketplace are a lot of folks saying, well, we found the new silver bullet for eliminating specialty pharmacy cost or for trying to curb certain different therapeutic classes. And I think that with a lot of that bolstered noise, we find that the industry also lacks sustainable solutions. There are no such things as silver bullets in this industry. Now, one of the ways in which we believe we've been able to attract and identify ways for cost savings is by looking at what we have identified as sustainable programs that are available to the broader marketplace, of which 340B is a good example. And there's been a lot of different solutions and enterprise solutions that have tried to crack into this avenue of how do we help employer groups and these community care centers or covered entities in the 340B space collaborate jointly to share in the ability to greatly reduce and create cost offsets so that employer can enjoy some of those savings that are afforded through the 340B program while also ensuring that the original intent of 340B is also respected and embodied in these kinds of solutions. And at Prism, we've been able to, through identification of the operational process, as well as a mastery of the economic model that 340B represents, bringing these different parties of employers, of the covered entity or the hospitals in these geographies, contract pharmacies, all of these parties together into an elegantly designed solution that helps folks access those deep cost savings while also creating a community-centered care structure that benefits all parties.
Jordan, I want to go back to, I know you and I have had a couple of conversations around 340B. You've been blazing a trail across America, talking to hospitals that are learning about or are taking advantage of 340B. What are you saying to them?
What we're finding here, even though 340B has been around for over 30 years, we still find that a lot of health systems that are eligible for 340B haven't really built out a program or have an underperforming program. 340B is a constantly evolving industry, and health centers need to be able to stay at the forefront of compliance in order to have a sustainable program. We help them achieve success both from a compliance standpoint as well as optimization. So we're focused on building out networks, building in-house pharmacies that participate as contract pharmacies within the 340B space, as well as protect our partners through implementation process, making sure that they are able to develop a program that's in line with the intent of 340B, as well as protecting them during the eventual HRSA audit. So we perform regular mock audits for our covered entities, as well as on-site audit support when they get the big call from HRSA.
What are some of the qualifying factors that I would need if I were a hospital to qualify for 340B distribution?
Sure, yeah. So there's over a dozen different eligibility types, ranging from disproportionate share hospitals to rural health centers, critical access hospitals. We're even working with sexually transmitted disease states within the 340B space now, who relatively recently got their eligibility and able to build out programs, a lot of Department of Corrections. So in order to really meet these eligibility requirements, you have to either be a not-for-profit entity or a government-subsidized facility. So most of these health centers serve a designated percentage of a population, depending on their eligibility type, below federal poverty guidelines.
I'm trying to connect the pieces here. So you've got hospitals and clinics that can distribute the drugs, but you're also helping employers and unions find discounted drugs. So help me tie those pieces together. How do you help the employers and the union groups?
Prism itself is really an industry-leading pharmacy benefit management consulting firm, first and foremost. And we range with over 100 clients nationally, ranging from all different sizes of employer groups. While we're also partnering with health systems across the country as well, we're trying to essentially match two clients together. So we find synergy between one of our health system partners as well as an employee group, usually strategically identified based on their demographic. And we would create essentially a menu item approach for their plan sponsor program, driving maybe specialty through the in-house pharmacy at a covered entity, sharply reducing plan costs. So it's really a mutual benefit for both the health system and the employer group. The health system will be getting new patients that have very expensive conditions that need treatment, and the employer groups can send their patients over to a covered entity that has an in-house 340B program and benefit from substantial cost reduction for their overall specialty medications. So the intent of the program is certainly to drive the majority of the savings to the covered entity, and we'll work behind the scenes to have a negotiated rate that is in line with the intent of the program and provides mutual benefit to both the health system and employer partner.
Yeah, so if I could take just a quick stab there too. I mean, Jordan's right on the money. I mean, what we're doing is really applying a more simplified approach to identifying, hey, there's a lot of cost expenditure specific to specialty pharmacy, let's say, for most employer groups. Anywhere from 40 to 60% of their planned cost is attributed to that particular bucket of spend. And so we also know that through the 340B program, covered entities and these local institutions, in many cases in the backyards of these employers that we serve, there's a synergy that just is not being made or at least realized today. And others have tried to crack this code, but I think lots of different conflicting interests have prevented the kind of success that we know is possible and that we see as possible. And so, really, Prism's role here is to be that of a liaison between those hospital systems or covered entities, the contract pharmacies that exist within their 340B ecosystem, but then also understanding how the employee benefit functions specific to pharmacy, combining those two entities or different organizations into a mutually beneficial manner that can sustainably tap into that value generated by 340B to create cost savings for the employer, for the consumer, the patient, as well as an integrated means of creating some additional revenues, but also better engagement with patients at a local basis. It really is the best of all worlds, and using a sustainable program like 340B to do so.
So I want to double down on two words that you guys have used: community and revenue, because I think that those are not often things that you hear being thrown around in the general PBM space. So I do want to make sure that for our audience, which is comprised of both healthcare leaders and also HR leaders, can you give us like a success story of how it is a community driven model that also drives revenue to a hospital system that may otherwise be struggling?
Absolutely. I think that COVID-19, it hit pretty much every industry, every part of the healthcare industry, employers, health providers, et cetera. And hospital systems are not excluded from that. A good chunk of revenue for many hospitals was greatly reduced, largely because of elective surgeries and elective procedures that just weren't taking place. A lot of community hospitals took a major hit during COVID 19. I think one of the other pieces that's important to note here in tandem with that is by a lot of other entities have tried to tap into 340B as a means to generate these cost savings. A lot of times they're accessing telehealth or telemedicine as a means to source the medications to be compliant with the program, 340B as a whole, but then also to steer or to drive utilization and members to less preferred destinations to gain access to those discounts. What we've been able to accomplish is by having direct, tactical, and targeted negotiations while bringing the employer group as well as that community hospital or that entity, that covered entity, together to the table to agree on a mutual set of pricing that is far superior than what would conventionally be achieved through the PBM, and by creating a situation where you now are keeping that care on those volatile products and therapies for those patients in the same community, by empowering that hospital pharmacy, that hospital system to be able to deliver the care from the provider, from the pharmacy to that individual, instead of supplanting that and actually sourcing it through, let's say, a PBM. And so this is a great way to ensure that pricing or the cost of care, as well as access to care, is centrally located within that given community ecosystem to do good for all those who are participating.
Now, the other thing I want to just touch on before we wrap up, I want to do kind of 340B for dummies, since you've got Lee, who's well versed in the benefits arena, and then me. Is this a replacement to a traditional PBM? Is it a complement to a traditional PBM, transparent PBM? How does it overlap into the plan itself?
It's a really great question, Sally, because this is where the devil is always in the details. I think that a lot of folks have glommed it. Well, there's huge savings in 340B, so let's just go after it. Well, it's not that simple. As we had mentioned before, so much of a program function like this is all about a tactical understanding of operations. You need to have aligned partners in a program like this. You need to have a covered entity or a hospital that understands the concept, that understands the economics, and also wants to participate in a sustainable solution. You also need to have processing partners who can administer the benefits as they need to be structured in order to, in a sense, make this program function seamlessly for the benefit of members and a functional program operation. So this is where Prism comes in and really does deliver a great amount of value. Not only do we have the skill sets, the chops, the kinds of talent that Jordan, for example, represents, he and among his team on all things 340B, but you really do need that hand holding, that aligned liaison that Prism really serves in being able to bring all parties together to accomplish that mutual goal.
Well, I want to thank you, Jordan Hytken, Ryan Rice, for helping educate our audience on the world that is becoming and growing in 340B. We love when you bring community hospitals into the employer space and really drive value there. So thank you. And we want to thank our listeners for tuning in to another episode of the Granite List Live. We at the Granite List are proud to feature partners like Prism. You can learn more about them certainly by visiting their website or also by reading about them on thegranitelist.com. With that, thank you all for joining us.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.